When the summer of 2014 came to a close and my first round of chemo was completed, it was time for surgery. In the early morning of September 10th, my family and I drove up to Sloan Kettering, arriving on the surgical floor at around 5 o'clock in the morning. We went into the pre-operation room where I changed into my gown and waited for my surgeon to come get me. I was brought into the operation room in my pre-op bed where I was switched over to the table. As I laid on the table, a collection of sharp tools used for operating sat across the room from me. While I mostly remained calm before surgery, seeing those surgical tools was the one moment when I actually got a little freaked out. I looked away from them and tried not to think about them as my surgeon and his assistants prepared the entire setup. Once everything was organized, the anesthesia was injected and I fell into my deep sleep. When I woke up in the post-operation room, it felt as if I had teleported there. The surgery lasted for 14 hours, but it didn't feel that way to me because the anesthesia apparently made the time go by fast. My surgeon removed a 38 centimeter long and 16 centimeter wide tumor that was my osteosarcoma. Furthermore, I had my left femur and knee replaced by a titanium rod and artificial knee. I even had 3/4 of my quadriceps removed because they were touching the cancer. As a result, I exited surgery with a scar that stretched from my hip down to the bottom of my knee. This wound will forever form the appearance of my left thigh and knee. Waking up from the anesthesia was a little rough for me. I was very dizzy, said random things, felt as if my teeth were falling out, and even got nauseous from trying to drink water at one point. I also had this feeling like I needed to get up from bed, but I had to lay still the entire night because my femur and knee replacement needed to heal. I was moved into my own single room on the 17th floor of the hospital, which was the head and neck floor. I was placed there due to the lack of space available on the pediatric floor, where I would have otherwise been kept during my stay. I had to be in the hospital for 10 days to recover from surgery. While I was inpatient, several family members and friends came to visit me. People even had gifts sent to the hospital for me. The support I received from those who care continued to be incredible, and I could not have been any more grateful for them cheering me on. At the beginning of my stay in the hospital, I struggled to move from my bed to the chair, being in severe pain from the operation. By the end of those 10 days, I was walking non-weight bearing with crutches for a total of 10 laps around the entire floor. I was one of the quickest patients to get off of the IV pain medication, as the narcotics knocked me out and I preferred to be off of them sooner rather than later. On September 20th, 2014, I was discharged and headed home. It was certainly very nice to be home after such a long hospital stay, and I was excited to move forward to finishing the rest of treatment.